Yes, I think so. We are 2 months into this outbreak, really, and I think it's taken a while for the significance of this to really register. And, this is affecting one particular group mostly at the moment, men who have sex with men, as we heard. And I think there is an element sometimes also, whether that's homophobia or whatever it is, but there is a sense that this, isn't the highest priority maybe sometimes for some people making the decisions. And so personally, I'm very happy to see that it is now getting the attention because we are still early enough that we can try and curb the spread of this virus, but we really need to act now.
So what do we have to do right now to curb it?
Right. I mean, the number one thing, of course, is to inform those people who are most vulnerable at the moment. So men who have sex with men, particularly if you're having, several sexual partners, just to give them the information, first of all, how to have, safe, how to stay safer. So, for instance, just reduce the number of sexual contacts, but also to know what to look out for and to spot the rash early on so that we get people diagnosed early on. And that way also, stop it from spreading that easily. And then there are vaccines. I mean, we are in the lucky position that there is a safe vaccine that seems to protect against monkeypox. So it will be really important to vaccinate those at highest risk as fast as we can.
Why do you think the virus is spreading mostly within the male-to-male sexual community?
So there's been a lot of kind of confusion there, I think. So I want to be very clear. The virus, of course, can infect anyone. But what we're seeing at the moment that it is in fact infecting mostly men who have sex with men. And the reason for that is the nature of the sexual networks, the social networks that we have. So if you think about it, a virus needs two contacts to spread. It needs me to have contact with someone who infects me, and then I need to have contact while I'm infectious with another person. Now, it turns out that monkeypox isn't really that infectious. And for most groups, for most social groups, it doesn't manage to do these two jumps. But there is a segment of the MSM community where there's quite a lot of sexual contact, so very close skin-to-skin contacts. And in that group, the virus seems to be able to make these two jumps, and that's why we see these longer transmission chains. Now, just to be clear, that doesn't mean that it cannot find other networks where there's, for instance, athletes, or there might be other groups. At the moment, we don't know. But the virus might spread into other groups where it can also spread. But at the moment, this is where we see most of the spread, and this is where we need to concentrate our efforts.
And that's the danger of treating it just simply as a male-on-male sexual disease and not alerting the broader population, as well as in many countries, even in our region, which don't even acknowledge male-on-male sex.
Yes, I think so. It is a difficult situation because we need to always be very clear what is the situation right now, why are we concentrating on one particular group, and at the same time make it very clear that the situation can change in weeks or months. And then, we do need everybody to be vigilant. And of course, on the edges of the sexual networks, there will be people, we've seen cases in women and children. So that does happen because you can, as a household contact, for instance, get this from someone. So we need to be careful. And yes, we need to be careful about how we communicate it because there is a risk of stigma. And of course, there are countries where gay sex is criminalized, where it's really difficult to even get the message out to make people aware of this risk to their health that they face.
Yeah. Kai, I wonder what your feelings are about this coming after 2.5 years now of COVID, with a lot of fatigue for people to listen to health messages.
Yeah, I mean, it is one of the sad ironies that I think our experience with COVID-19 has made it harder to fight this. I always say that in public health, trust is a resource that you use. It's like a reservoir. And the sad truth is that in a lot of countries, that resource has been used up. There's less trust than there was before. So people are very kind of mistrustful sometimes of public health guidance. And of course, at the same time, this is a sign of the things to come. We do live in an interconnected world. We have climate change. We have, the destruction of nature in a lot of places. The animal-human interface is increasing. So the likelihood of viruses jumping into humans and then spreading fast is becoming higher. So we're in this moment where we need to be better at dealing with it, and sadly we seem to be worse at dealing with it.
Yeah, that is a great point that you make, because people probably don't see this as a similar kind of issue that we still, unfortunately, after the COVID outbreak, the politics got involved, and that's kind of stopped that, hasn't it, to a degree?
Yes, I mean, these are failures that are compounded by the failures of the past, of course. One of the monkeypox researchers I've talked to, Anne Remoyne, she always says it's easier to stay out of trouble than to get out of trouble. So what we really need to do getting forward is to make sure that we stay out of trouble, because as this shows once again, once the trouble is there, it is much, much harder. And we have seen this virus for decades, causing illness and causing deaths in a few African countries where this is transmitted by animals. And we didn't really care in the West that much. We didn't invest the resources to study this and to fight this the way that we maybe should have.
Kai, really great to get you on. Thank you so much.
Pleasure. Thank you.